Immunization issues. Immunoprophylaxis. A vaccine is a drug that ensures the development of immunity and immunity to pathogen. Vaccination is active immunization of the body. Vaccination is one of the best ways to protect children from infection diseases that cause serious illness in the absence of vaccination. Vaccination is a creation of artificial immunity to certain disease. Immunoprophylaxis. The human immune system consists of central, thymus, bone marrow, and peripheral, spleen, liver organs. There are mechanisms of innate immunity that act immediately and are the earliest response to infection. If pathogens pass through this early illness of defense, the mechanism of adaptive immune response are triggered with the development of antigen-specific effector cells. Within a few days, specific immunologic memory is formed, which provides long-term protection when reinfected with the same pathogen. Immunoprophylaxis classification, we have two types of immunity types. First, innate immunity. Second, adaptive immunity, which included natural acquired and artificial acquired. Factors determine the need for immunization: the rate of specific disease, formation of immunity to the causative agent and infection disease, efficient safety, cheapness, and accessible lack of alternative for the prevention of this disease. Vaccine requirements. The vaccine must be safe. It should induce protective immunity with minimal side effects. The vaccine must be immunogenic, must induce the correct necessary of the type immune response that should stimulate a specific immune response, must be stable during the cell life. Types of vaccines: bacteria-killed and live virus with weakened pathogenetic. Live viral vaccines are given with an interval of more than 1 month when inactivated, or with another live vaccine, an interval of more than 2 weeks is recommended, preferably 4 weeks. And currently, there are 4 types of vaccine containing weakened live microorganism: polio, measles, mumps, and rubella vaccines containing a killed microorganism, pertussis vaccines. Biosynthetic vaccines containing toxoid, toxin produced by bacterium or virus, contain substance obtained by genetically engineered methods and causing an immunity system reaction. We have some rules and regulation for the organization and conduct of immunoprophylaxis of infection disease in the Republic of Uzbekistan. Also, we have calendars of prevention of vaccines, and we start in our country vaccinated all our children in first day with vaccine viral hepatitis 1. Characteristics of vaccines used for immunoprophylaxis. We have types of vaccines, or live vaccines, and another. Indication for immunization. There are corresponding to the date of immunization according to the vaccination calendar and favorable epidemiological situation. Temporary contradiction to immunization. Moderate and severe somatic and infection disease immunization should be carried out 3 and 14 days after recovery. Acute respiratory infection and mild forms of diarrhea are not contraindication. Patients with chronic disease of heart, liver, kidneys, lungs, diabetes, and other endocrine disease are subject to vaccination during remission. Severe reaction to previous doses of vaccines. Vaccines containing pertussis antigens are not administered if encephalitic reaction, seizures, anaphylaxis, or collapse were noted during the administration of the previous dose of the DPT vaccine. Aedes anastoxin should be used to complete the course of immunization. Persons with anaphylactic reaction to the components of vaccine are not vaccinated with the appropriate vaccines. Children with neurological disorders that are not vaccinated with vaccines containing the pertussis component. Also, children with stable neurological disease are subject to vaccination according to the calendar. Children diagnosed with encephalopathy should consult with neurologist before the age of 2 months to rule out progression of neurological disorders. Contraindication to use live viral vaccines, it means measles, mumps, polio, and influenza are congenital immunodeficient condition, drug immunosuppression, and pregnancy, and people who have HIV viral infection. Children with allergic disease in sick children with asthma may have who have high fever, allergic dermatosis, and eczema. Vaccination are carried out in remission if necessary against the background of antihistamines. Newborn babies with small gestational age and weight. Children who have not been vaccinated in the first days after giving birth to the disease should be discharged from the neonatal pathology department. Newborns from mothers with active tuberculosis are isolated from their mothers immediately after birth and with vaccination for a period of 2 months. Contraindication for live vaccine, immunodeficiency. Due drug immunosuppression, children receiving cytostatic radiation, pregnancy, children, and children who have HIV infection, bronchial asthma, high fever, eczema, all vaccination in remission except polio. False contraindication, temperature more than 37.9 per Celsius, allergy, thymomegaly, dysbiosis, abnormalities in the immunogram, progression-free PEP, perinatal encephalopathy, family history of seizures. Antibiotic treatment, chronic disease of the lungs, heart, liver, kidney, stable neurological conditions, it means cerebral palsy, Down syndrome, premature baby, hypertrophy. What you should know about vaccination office. The vaccination room should be wet cleaned 2 times a day using a separate mark cleaning equipment with the used detergents and the end of the day with the used disinfection. Caring of vaccination. Every medical worker who conducts vaccination must know the SAMPIN rules, follow the rules of handling vaccines. Remember that measles, rubella, and mumps vaccines and BCG vaccine must be used within 6 hours. Vaccines diluted and used during the period should be destroyed. Before the vaccination, the nurse must check the availability of doctor's opinion. What she or he need to wash the hands, check the name of the drug ampoule, care of necessary procedures for the preparation of the drug. After vaccination, you should make an entry about the vaccination in the medical documentation, indicating the name of the administered drug, the date of its administration, dose, and series. Also, after vaccination, some patient may have post-vaccination reaction. Post-vaccination reaction, short-term unstable disorders that occur after vaccination and do not disrupt the viral infections. The body post-vaccination reaction usually not disrupt the general condition of the child and go away on their own. Vaccination reactions are not an obstacle to subsequent infection of the same vaccine. Also, after post-vaccination reaction, some baby may have local reaction, thinking of tissue hyperemia less than 8 centimeters in diameter. Mild soreness in the injection site of the vaccine develops immediately after administration of both live in intimate vaccines and resolves within few days. Common reaction in post-vaccination reaction, you may see fever or short intoxication. In clinical signs, in headache, sleep disorders. Common vaccine reactions are divided in mild, subfemoral temperature, moderate temperature, higher than 38.5 degrees, and severe fever above more than 39, pronounced symptom in intoxication. Normal post-vaccination reaction for mumps, catarrhal manifestation, for rubella, arthralgia, etc. Post-vaccination complication occur a result of vaccination prevents the repeated administration, pharmacological effect of vaccines, tumorigenic effect, the immunomodulator effects, and physiogenic effect. Post-vaccination complication invited anaphylactic shock, severe generalized allergic infection, encephalitis, central nervous lesions, generalized infection. The arthritis is chronic, caused by rubella vaccine. Timing of development of post-vaccination complications. They must often develop the first 24 hours after the introduction to the vaccine during the peak of the vaccination process, the first 2 days after introduction of inactivated vaccines. Causes of post-vaccination complication, reaction in prior selection for vaccination, of the rules and techniques for vaccine primer, quality of vaccines, spoilage of the vaccine during transportation and storage, individual reaction of the body. Urgent medical measures for the development of post-vaccination complication. Hyperthermia, convulsive syndrome, and in this case you should immediately use diazepam, febrile seizures, antipyretics, and seduction. In anaphylactic shock, please immediately use adrenaline in subcutaneous or intravenous. Hypothermia below 35.5 degrees Celsius. Antihistamines, biostimulates. In asthmatic attack, immediately use euphyllene. In local reaction, you should use calcium gluconate and etc. Preventive vaccines. This is well-being of every person's health. They help prevent dangerous infection. Thanks for professor vaccination. Diseases such as measles, polio, diphtheria, and whooping cough are becoming less and less common. If the child does not receive them in timely manner, he may get sick. Children can be vaccinated even if the havoc would be no fever. If a child has missed a particular vaccination, it is necessary to get it as soon as possible. In case of anxiety after vaccination, you need to distract the children. It is necessary to consult a doctor again in case of a local reaction to the vaccination in the form of swelling or redness more than 2 centimeters of diameter. In case of prolonged anxiety and fever up more than 38 or more after receiving the vaccination.